Art therapists often work with children who have physical health conditions. There is research to suggest that it has both psychological and physical benefits for patients. Having previously worked in children's cancer care, I've been interested to find out what art therapy may be able to offer in this area. According to Cancer Research UK, around 1,800 children are diagnosed with cancer every year. Out of this number, 82% survive. I want to know, in the current economic climate, is there a place for art therapy in offering psychological support for children and young people after their cancer treatment has finished? Although there is a great deal of literature and research around the emotional and psychological impact for children and young people on active treatment, there is comparatively little research into the impact after treatment has finished and into survivorship. I spoke to Andy Whitehouse, team leader of Click Sargent Oxford, a charity who support children and young people with a cancer diagnosis and their families. He talked about the emotional support needs for children and young people who have finished cancer treatment.
The emotional support is different for every single person and every patient or every child or every family, because they all go through different cycles of what they're thinking and feeling at different times. And the same happens when it's post-treatment. They come to the end of or they come to the maintenance stage, where it might just be checkups at the hospital once every few months, or just a little bit of treatment every 6 months or so. So it's a different impact on the people, because they're trying to get back to the old norm of what family life was like beforehand, or work life was like beforehand. So you're helping them come to terms with the emotions of all that change in their lives and change and so on. It's also the impact on families of if a child has been undergoing 2 years say of treatment and now they're back in the family home full time, what impact and emotions has that got on siblings? All the attention was on, understandably, the sick child during the treatment. Now little Johnny's back into the family home, and maybe the siblings who are at home are feeling left out, or they're feeling jealous, or they're feeling angry and guilty themselves, and going through a whole load of emotions themselves for the child coming back into the family home. Maybe there's some resentment in there as well. So the family dynamics change, and they have to be worked through as well.
One of the few policies providing an insight into this area is the Teenage Cancer Trust Blueprint of Care. In their document, TCT highlight that while many cope well in challenging circumstances, long-term survivors of adolescent cancer are thought to be at risk of depression, anxiety, and post-traumatic stress disorder. This highlights the importance of two things: the need for comprehensive long-term follow-up, which includes assessment of psychological late effects, and the need for psychological support post-treatment to address the specific concerns of young cancer survivors and in order to prevent long-term mental health problems. The National Institute for Health and Care Excellence also provide guidance on when a psychological needs assessment should take place. They state that this should include during long-term follow-up. Their guidance also says that service providers, practitioners and commissioners should refer to appropriate specialists where needed. I asked Andy about where Click Sargent refer to if a child or young person needs further emotional or psychological support after treatment.
So we'll refer on where we can and where there are services. Some of the problems are the resources in the community are not as robust as they should be. There's certainly been some cuts over the past few years, and it's less there than there used to be. So I do know that our psychology team here will do some follow-up appointments at end of treatment care, and we're trying to get back into running end of treatment days again. We haven't done them for a year or so here in Oxfordshire, and that's where we talk about the psychologists talk about the psychology of end of treatment. The doctors and the medical side talk about that end of treatment, what that means for them and what their involvement is, and we will do what we can for emotional and practical support as well.
According to art therapist Marion Liebman, art therapy with children with health conditions can offer a reflective space where the child or young person can express their internal thoughts and feelings. The art materials can feel physically soothing and be a contrast to invasive and unpleasant medical treatment. Similarly, Kathy Malchiodi, art therapist and psychologist, says that spontaneous drawings help with emotional expression and self-efficacy. The art therapist can also gain valuable insight into psychosocial aspects that do not always come to light through talking alone. I asked Andy about his experiences of referring children and young people to art therapy.
What's your experience of people accessing art therapy as a form of psychological intervention?
So we've done some referrals ourselves for children who are undergoing treatment and their siblings, and that was really useful. It was pure coincidence that there was a couple of families who were living close by in Swindon area, and we managed to find an art therapist down that area who would do something for us. So she worked individually with the children who were having cancer treatment, and then at the end of the 4 or 5 sessions she did the 2 children together and their siblings together for a joint session. That was really beneficial for those children to come to terms with the emotions of what they were experiencing during treatment. Not just the ones having treatment, but also their younger siblings as well, trying to understand what cancer treatment was if you're preschool age. It's quite a complex thing to understand, and that was really useful and beneficial.
Andy's experiences of children and young people accessing art therapy was largely positive. However, as he previously mentioned, there is a lack of resources in the community due to cuts over the past few years, and access to art therapy is no exception. We talked about group work, a cost-effective way of supporting children and young people after cancer treatment and their siblings.
Art therapy is still a fairly small profession and is expanding much more into doing more group work generally. Do you think if it was more available, there would be more interest in it? Do you think it's something that people would find valuable in terms of group work?
I think for some young people, groups are really, really important. It's shared experience and realising you're not on your own in going through the treatment and the diagnosis and all the horrible bits that come with cancer. Somebody else has had the same or very similar to you, or feels the same or very similar to you, and sharing it is a good way of offloading some of those stresses and worries and emotions that go with it. And I think that we find certainly as young people move more into teenage and young adult age, that sharing is more beneficial. And having seen it work and know that it does work for young people of different ages, I can see the benefits in using it.
One of the biggest challenges in art therapy are the cuts that have happened across the art sector. This has had a huge impact on all children and young people. Here is Val Hewitt, CEO of the British Association of Art Therapists, talking about this issue at a conference last year.
And this brings me to our children. We have got a tsunami of child mental health issues. What's happening with our children at the moment is that the arts are being culled from the curriculum. They are being taken away because there's no resources, and they just are not accessed by children who are not lucky enough to get this as part of what their families may provide. So we are forming a problem that's going to be really difficult later, because when you do access the arts at school, it opens up something about learning about yourself, about others, about compassion, about empathy. It's really part of our mental health and our development. So the more we take the arts away from the curriculum in schools, the more we are sort of impoverishing the possibilities for our children to use that as part of their own growth, and maybe actually take this up as something that they may want to go into.
One of the things Val highlights is that the arts are getting cut in schools, which has a negative psychosocial impact on children and young people. However, in the field of art therapy, many art therapists are being contracted into schools to support more and more children who have these mental health issues. This highlights that schools still consider there to be therapeutic value in creative arts. In the case of young cancer survivors going back to school, art therapy may be a way to ease the transition back into a normal routine. Here's Andy talking about some of the difficulties of this transition.
So if a child's going back into school, their social group has changed dramatically in the year, 2 years. because they've all grown up, relationships change anyway in groups. So how this patient then, who's come through the treatment, going to fit back into school life and back into those social groups, and the emotional impact of that can be quite challenging for them.
So, is there a case for art therapy in children's cancer services? From my research, it seems clear that the emotional and psychological needs for children and young people following cancer treatment are complex and can be long-lasting if left unaddressed. Art therapy could therefore be an effective form of psychological support for these children and has been found to be useful by professionals in the field like Andy. The question remains how this can be best funded and sustained, but perhaps art therapy groups and support in schools could be useful ways of making art therapy accessible to more children and young people who are cancer survivors.